It's a silent health issue that you may not notice until it's too late. In fact, 10 million people are affected by it in this country. And Dr. Kevin Kirk, orthopedic surgeon with the San Antonio Orthopaedic Group, is here, and we're talking about osteoporosis. And May is Osteoporosis Awareness Month. So what exactly is it?
Well, it's when you look at your bone, you have two parts of your bone. You have the harder outside covering, the hard bone, and you have a softer inner core. And so it's almost like a lattice work. And so this is an example of a normal bone. What happens with osteoporosis, over time, the bones become a little bit more brittle. And so you lose a lot of that harder outside covering, as well as that inner lacework of the soft bone breaks down a bit, making it more likely to break a bone.
We hear a lot about eating foods with calcium and vitamin D to help prevent osteoporosis. If it's preventable, how big of an issue is it?
Well, I think the #1 treatment for osteoporosis is prevention. And so eating foods rich in vitamin D and calcium, drinking your milk and eating your cheese and yogurts are very helpful. The other things that are very helpful are regular weight-bearing exercises, walking, muscle strengthening exercises, and then also limiting your alcohol intake, as well as stop smoking. And then also, probably more important, so if you know somebody in your family over the age of 50 who's had a broken bone, is to talk to your doctor about it, because there are treatments that can be even more beneficial to prevent the problems with broken bones. So this is the actual end result of osteoporosis. This is a hip fracture which is fixed with an intramedullary device. And probably the facts that people don't know, the severity of a hip fracture in an elderly patient. There's about a 25% likelihood that you could die within that first year. And so once you sustain the initial fracture, you have about a 1 in 2 chance of actually sustaining another osteoporosis-related fracture. 1 in 2 women and 1 in 4 men over the age of 50 will experience an osteoporosis-related fracture. People don't really know that they have it until they break a bone, and that's where the orthopedic surgeon comes in. We fix broken bones all the time, which is the first sign typically of osteoporosis. And so what we're trying to do is raise awareness to do something else, because we talk about the preventative measures and things like that. And so here at the San Antonio Orthopaedic Group, we've actually developed a fracture liaison service, or a bone wellness program, in which we kind of take people that have had these fragility fractures and try to prevent the second one from occurring by making sure that they have the appropriate counseling as well as the appropriate evaluation.
May is Osteoporosis Awareness Month.
Correct. And so if you're concerned about your bone health, or if you've had a fracture and concerned about having a workup of that, feel free to call the San Antonio Orthopaedic Group, and we'd love to be able to help you with that.
Yes, go ahead and call the largest orthopedic practice in San Antonio and South Texas at 210-804-5500. Again, that's 804-5500, or visit TSAOG.com.